Hello again. Welcome to Ask Dr. Pane. Today we've got a great question about disappointment with a labiaplasty result. And this is a person that is about 10 days out from a labiaplasty, where it's described as a clitoral hood reduction, fat transfer to the outer labia, and then reduction of the inner labia. And they're not happy. They kind of described in a little vulgar terms what things look like right now. Things are hanging down, and they don't like the result. Now, they want to know if something needs to be done. What I would say is when you talk about labiaplasty surgery, a lot of doctors do the labial reduction. Not everyone does the other maneuvers that can be done. Majora augmentation, majora reduction, clitoral hood alterations, and the internal surgeries. It's okay if somebody just does the labiaplasty part, but in general, if you're in a practice where they do everything, which is ours, we're glad to say, you're going to have potentially a more comprehensive assessment of what's going on and what the results should be and what the trade-offs are in each case. What I would tell someone in this case, you're only 10 days out. I don't have any pictures here to describe because they weren't sent. So what I would say is unless something is really seems very wrong or abnormal, just kind of take a deep breath, keep going to the follow-up appointments, see how things go. It can be a lot of swelling early on with these procedures, and sometimes it will not look the same side to side. It shouldn't be way off, but it can be a little bit different, and it'll change day to day. When you get further out, and we're talking 3 weeks, 6 weeks, you're getting more to the point where the results are going to get more final. Now, if you're at the 3 to 6 week mark and something really is off, then it's possible something else may need to be done. Often your surgeon will revise that for you if needed, but that shouldn't be done right away. Even though you're not happy about it and you're at 6 weeks, there's very little to be gained from going back too early. Usually people will tell you to wait at least 3 months, and I would prefer even longer, maybe 6 months, before you do any kind of secondary work. I'm happy to say that most of the secondary work we do in our practice has come from procedures that have been from outside. My own revisions rate, it's actually measured in the number of years it's been since we've revised any of these, which is a little unusual. I don't think anyone's going anywhere else, but we're always paying attention to make sure people are pleased with their results. The good news is the area does heal very well, and if someone does this a lot and you have the right expectations and the procedures match to that, you're going to get a good result in most cases, and almost everything can be substantially improved as well. So if this one doesn't work out for the person, I wouldn't lose hope. There's a good chance of getting it right down the line, although it may require a different surgeon and a second procedure, but by and large it should be improved quite a bit. So hope that helps, and we will talk to you next time.